starting in the early 1990s, criminologist scholars took the what works theory that had replaced the previous belief of nothing works and started to apply it to the unique offender population of women. One of the first major studies to look at women offenders was conducted by Coons, Marash, and Bynum in 1995. They looked at 67 studies that focused on women offenders. However, only 12 of these had objective measured outcomes, and so it was generally inconclusive if there were unique needs that needed to be addressed for women offenders. However, the conclusion they reached from that study was that women offenders have unique needs such as drug abuse, education, parenting, and dealing with past victimization that affected their reoffending or their offending in the first place. And they believe that addressing these individual and unique to women non-criminogenic factors might lead to lower recidivism rates among women. However, the meta-analysis we're focusing on today by Dowden and Andrews wanted to test if the general risk, need, and responsivity factors that are applied to the larger male population would also work for women. The two samples used in this meta-analysis were taken directly from Andrews and his colleagues, and then the second sample was taken from Andrews, Bonta, and Dowden in a sample of 220 participants using qualitative methods consisting of the groups consisted of primarily or only women. They wanted to use qualitative methods to see if women would reoffend. It was a longitudinal study over time, and they believe that a follow-up period of 30 months would be vital to measuring recidivism. And when they say recidivism in this context, they are talking about reconviction rather than rearrest or parole violations. However, they are included in this study just to include more data and have a at least slightly larger sample size. This study used coding, which is the organization and then the easy interpretation of data through numbers to measure various variables. To measure risk, they had high and low risk, and so that is a binary coding. If an offender had a previous arrest record or had current involvement in the criminal justice system, they would be considered high risk. Those are the two primary factors they measured, and so to do that, it would just be a 0 or a 1. 0 being low risk, 1 being high risk. If one or both of the factors are met, it would be coded as a 1 for being a high-risk person, a high-risk offender, and then they would be eligible to receive the more intensive treatments that are needed for high-risk offenders. This study, unfortunately, only looked at general responsivity in women offenders, meaning what cognitive or behavioral treatment therapies were most effective for women as a whole, and they did not tailor these therapies or treatments to the individual. So we do not know if a certain learning style is more conducive to reducing recidivism and reaching women offenders. The need principle was measured also with a binary code of zeros and ones, and this was simply if the need principle was deemed to be adequately addressed in the study, it would be coded as a 1. It was just fine. And if they believe it was ignored in the individual treatment group, it would be coded as a 0. And then finally, they coded proper implementation of all three of the R&R principles on a composite score of 0 to 3. If one of these principles was met, it would receive a score of 1, and they would be added up at the end. So if none of these needs were met, or none of these principles were met, it would be coded as a 0, and if all three were met, it would be coded as 1, and then in between if it was 1 or 2 of the principles met. And then they also organized the studies based on effectiveness from little promise to weak promise to promising, and then the strongest being most promising. The results were gathered from 26 studies. 26 studies were included in this meta-analysis, 16 of which were only female offenders, And these would be the ones we'd want to focus on most, as they would be most accurate to women offending. The treatment group, consisting of only promising and most promising offenders, had a recidivism rate, or I misspoke there. The treatment group consisted of only the promising and most promising services and had a recidivism rate of 43%, while the control group consisted of weaker service and had a recidivism rate of 57%. This infers that appropriate application of the 3 R&R principles is also effective at reducing recidivism in women, whereas the control groups, which either used the more normal or standard criminal justice procedures, such as intensity of increasing the intensity of parole or probation or reincarcerating an offender, proved to be less effective than a more service-oriented approach to reducing recidivism in women, and that is mostly applicable to almost all but the most serious of offender populations. This focus on criminogenic needs in using cognitive and behavioral social learning therapies that previously has been proven to work with men also worked with women. And so what we can take away from this is that for now, we should focus on the risk, need, and responsivity factors in both men and women, rather than the principles or ideas that were held by people such as Coons, Marash, and Bynum, that like parenting or a family-oriented or victimization-oriented non-criminogenic need approach is not as effective as simply the R&R principles. 31% of these programs that were in the treatment group focused on interpersonal criminogenic needs, such as family ties, families, and friends being pro-social and encouraging the offender in their treatment. And then these that focused on family association and their peers proved to be more effective than the programs that focused on school or work or drug abuse and past victimization. So the most important non-criminogenic need would be the family process. However, the general risk, need, and responsivity factors still take precedent over this. The general takeaway is that at the end of the day, there's not enough information to reach any hard, fast conclusions about the unique properties and needs of women offenders, and that much more work needs to be done in the future. This analysis didn't investigate if the programs had unique learning styles for women, and if those styles would be considerably more effective than what the general R&R principles. In the future, we can only hope that women are a more prominent focus of the criminal justice system, especially when it comes to corrections, as there's not enough known about them because they make up a much smaller percentage of the general offender population.